Our nation's early childhood system aspires to be comprehensive, holistic, and equitable for all. It offers services for expectant parents, young children, and their families. It supports their health, mental health, early care and learning, and economic well-being. Programs operate with a shared goal that children and families across our nation can grow and thrive. But much work still needs to be done to realize this aspiration. The Early Childhood Systems Collective Impact Project aims to re-envision a coordinated approach to program implementation designed to advance equitable early childhood and family well-being outcomes. This project developed a series of recommendations to inform federal action across multiple agencies. Our next step is to transform those recommendations into actions. But first, we need to pause and listen. We need to listen to the perspectives of those who have experienced the opportunities that services make possible. We need to hear about the barriers that block access and participation. We need to listen to the perspectives of those who participate in services and those who strive daily to deliver them. We need to listen to those who have been leading the charge at state and local levels to realize systemic change. Now, let's listen to some of those voices.
Fundamentally, people with children need generally the same things. They need food, clothing, shelter, medical care, housing. They need all the basics, and they need the tools to thrive. And there are so many programs available that can help families thrive. We need to understand what is working and what is not working in different places. And the federal government is really the place, I think, where all of that can be pulled together. It is a central organizing principle in our country that our federal government helps us understand what we need as a nation. And this is a national need. This is a national problem that we need to solve together.
So for me, a national coordinated system would have some kind of infrastructure where there are shared goals and identifying the levers that can be pulled and can be supported for states in local areas to really optimize their ability to create real integrated systems and supports to support the physical, developmental, social, and relational health of children. And so for me, that falls into a number of categories, but it should be intentional. The federal agencies need to work intentionally with a shared vision, recognizing the already existing assets and supports that we have.
Whatever door kids are walking in through, whatever funding stream is attached to the space that they are going to be in, whatever part of the system they come in through, that they get a consistently high quality experience, that it is easy for families to enroll, that they don't have to do it multiple times in multiple different ways and go through lots of different hoops, and that once that kids are in the system, right, they can expect a level of consistency and quality in what they are getting, with individualization where it needs to happen. And that I think, to me, the most important part of a coordinated system is what we're coordinating to, right? Not just that we're aligned, but that we're aligned to something good. And so ensuring that it is coordinated, right? And aligned to the highest quality standards that we have.
We've had a lot of families that have reached out to Family Voices as an organization, or that I have spoken with individually, that have said things like, I called such and such organization, and I think because my English isn't great, they assumed I didn't understand. Or because I needed someone to speak to me in Spanish, or because I needed someone to speak to me in another language, because I needed interpretation services, that they assumed that I didn't understand, or that I was too much of a burden for them to actually help.
We need to listen to the community's voices, and that is not something that government does easily. We're used to telling the community what they need and telling them what they're going to get. In order to do a good job, though, we need to really ask them, what do you need, and how do you need it to be provided to you? And that takes courage for a government that isn't really oriented to listen that way. It takes leadership, and it takes a commitment. So we need to have that really come from the federal government.
Nobody's paid for the collaboration. When you go to a meeting, when you decide to collaborate, that's other duties as assigned. Your duty, the way the silos are structured, is transactional services. How many people got WIC? How many people are in TANF? How many transition off? Do you have open slots in early learning? How are you filling those slots in early learning? Your job isn't the collaboration. And so it reinforces the silos, because what I get paid to do is transactional, and what I know I need to do for families is more collaborative, and it's not in the job description.
Otherwise, people tend to be protective, worried, afraid that they're going to get into something they can't achieve, which is, to me, the biggest barrier in states and state leaders seems to be that they want to do the right thing, but they're worried they're not going to be able to have the resources to do it. And so I think part of it too is looking at some of the resources that can be brought by the state to support these collaborative processes, where we don't just talk about what we want to do, but we have the time to actually keep meeting, and it's part of our jobs and you're paid to do it. So it's not a sideline to create a collaborative approach across agencies, but it's a real job that's supported and staffed.
What I really want is for the federal government to join with states, and let's go do the work in the hard places. And what I mean by that is there's lots of places where we removed hospitals, where we know there isn't childcare, where we know that there isn't an economic center and transportation. Federal government and states should join together. Let's go make the work happen in those places. There are lots of incentives for not working in those places. They don't have the same infrastructure. They don't have the same partners. They certainly have partners we haven't worked with before. So I'd really like to see the federal government and states get together, and let's make it happen in the hard places, and that'll have a ripple effect for others across the state and across the country.
Think a lot of early care and education by design is segregated, right? By income, and in a lot of places that income is a proxy to race and other various factors. We have a special ed system in preschool that is often also segregated from the rest of the system, and those children with disabilities segregated from their peers. So this coordination becomes more, it's not just coordination for coordination's sake, or even for ease, and reducing burden for families. It's because it matters, and it's influencing the experiences that children are having in programs, their access to an integrated, diverse setting versus our perpetuation of like segregated, self-contained settings by income, by disability, by race and class.
The lesson I really want to share is that it's possible. We have done it. I see leaders doing it every day. They're doing it on the fringes. They're doing it when special funds are available. They're doing it when they can take a little off the money that's there. But it is possible, and people are doing it. People are putting grants in places that never had grants before. But we need to recognize that the time horizon between offering the grant and getting the change you want is much longer if you're working new with new sets of partnerships and new relationships, and especially if you're responding to the feedback loop of community. So one, it's possible, and two, people are doing it, and they're doing it with new partners and new organizations and new groups in communities, and three, that change process takes longer than you would expect. I always say, speed is the enemy of equity. If you really want to let all the voices be involved, if you really want to let people's voice be there and really create feedback loops, the time frame is a little bit slower.
One of the things that I will say is the time and effort it takes to properly connect and create trust amongst community and families is a really daunting task. And it takes a mind shift of understanding that you are now going to share power, and you won't be able just to dictate what's going to happen. But being able to create that collective impact space through a federal program have allowed above and beyond successes to be achieved by taking the time and proper listening and flexible, consistent methods to show the space is responsive. So the time to create the foundation and equity in practice, though it may look like nothing is happening, once you get your feet on the ground of how you're really going to move forward after hearing and listening and thinking through all the different ways, the outcomes are so much more meaningful and they're above and beyond what you think is going to happen.
Do we have a principle that we stand on? Is it that when somebody has a need, we are here to meet it? Or do we have a principle that says if somebody has a need, they can shop around and see what's available? It would really be better if we said that we are here to help people wherever they are, whatever they need, and here's the system we've put in place to make sure that happens. That would just be better. We'd have better outcomes. We'd have children thriving and growing up into be thriving adults and to be productive members of society. We have to remember that everything we put into families with small children is an investment in the future. It's absolutely an investment.